Hi, my name is Dr. Scott Timms. I'm the Assistant Vice President for Campus Health. I'm excited to share with you information about all of the campus health services available to our community. And I have responsibilities for the Health Center for Student Care, CAPS for Counseling Services, the Well for Health Promotion, and Pharmacy. Campus Health provides a comprehensive set of health programs designed to meet the needs of both undergraduate and graduate professional students at Tulane. Through this orientation presentation and the different modules that you'll see, you'll be able to learn more about those and how to access those services. We complete the National College Health Assessment version 2 every 2 years at Tulane to help us understand what our students are facing, what behaviors need intervention, and how we can best support your or their work here. What we know for our first year students, we consistently see these top academic impediments: cold, flu, sore throat, sleep difficulties, anxiety, and stress. And so for a student coming in, these are the things that they should expect and be prepared to deal with. A lot of our initial programs and offering to students are really to help them be ready to manage this. Early fall, we do a free flu shot campaign and do a lot of education around how to take care of yourself or to take care of your roommate when you're ill. We also talk a lot about sleep with our peer education program, getting students out there and really thinking about how to take care of yourself and to manage your sleep so that you can be effective. Anxiety and stress is a normal part of the college experience when you're transitioning. So we have programs that are designed to help students manage anxiety and stress on their own, but also we have the support systems in place so that when a student can't manage it, they can seek appropriate help from a professional counselor or psychiatrist. Based on the data that we have and what we see on campus with our students, there are a few trends that I think that are important to understand as you're beginning your time with Tulane. We know that nationally there's an increase in demand for both physical, mental, and support services for students, and the severity of the issues that we're seeing are very different. A decade ago, our counseling centers were, really treating low-level adjustment and much more less severe issues. Our health centers were not dealing with chronic illness, but now more than ever, our health centers and our counseling centers and our health promotion offices are having to address a much higher need student population, which has caused us to spend a lot of time introspectively looking at what services are needed and how do we best meet the needs of our students. We also know that nationally there's an increased use of drugs and alcohol, and we're also seeing students report negative consequences related to that use. And so nationally we see that, but we know that at Tulane this is an especially concerning problem, knowing that our alcohol rates are some of the highest, if not the highest in the country. So we have taken a very proactive approach as an institution to address these issues and to be setting standards for students that alcohol use, high risk alcohol use is inappropriate and that needs to change. We also know that this is a generation whose self-advocacy and resilience is decreased. We are seeing students oftentimes relying on families or caregivers, parents or guardians to be the person to intervene on their behalf. And as healthcare providers, we often need that student to work with us. So we see our parents and the students' support networks as being key to working with us to support them, not sort of serving as an intermediary for their healthcare. Because at the end of the day, it's important that that student learns how to communicate to a healthcare provider so that they can get the help that they need. We also know nationally and at Tulane we have an increased focus on Title IX and other compliance issues. We take sexual violence, sexual misconduct extremely seriously, and it is something that we have programs and services designed to support students and help them through that process. We also know that there's an increase in reporting of issues such as sexual violence and alcohol use, drug use to administrators. And so we have programs and services set up so that if a student's concerned about someone, they can report that anonymously. I have parents, I have students, I have friends who reach out to me and say, this is going on, what can I do? We have multitudes of reporting systems to help students get information into our hands so that we can take appropriate action when necessary. The Campus Health Access Fee, which is currently $320 per semester, is automatically assessed to most degree-seeking students. If they're full-time enrolled, that will always be assessed as part of the fees that students are charged. Sometimes if a student drops to part-time or for graduate professional students in a varied status, that fee might not be assessed. But access to any of the services at the health center, CAPS, or the well are predicated on students paying that access fee, which allows our services to exist. Anyone who's not assessed the fee must pay that fee in order to access any of our services. The fee can be charged at the time of service. They can walk in and pay it at our desk at the health center. They can also request that through accounts receivable if necessary. However, we do offer access to our referral coordinator at the health center or the care coordinator at CAPS to find community providers without a student having to have had pay the access fee. So we will always help a student who doesn't have access to our services find appropriate health care in the community so that they can be taken care of. I get asked often, what does the campus health access fee cover? And so this provides you sort of that full range of pictures. The access fee was designed so that we could provide comprehensive services to students. And so we use that to fund a 24/7 nurse line. We have the line, which is available for mental health support. It gives you entry into the health centers, both uptown and downtown. Now, both uptown and downtown health center also bill insurance, so there is a little bit of out-of-pocket cost, but again, we keep those costs low because we do have the access fee. Access to care from CAPS is at no charge because of the access fee. Care coordination from CAPS and the health center referral coordinator are all covered as part of that access fee. We also provide Tulane Emergency Medical Services, which is an on-campus ambulance service that's provided on the Uptown campus. Any of our health and wellness web resources, we provide free safer sex supplies. We provide assistance with navigating health insurance. So if a student needs help with billing or trying to understand why they got charged for this, we will work with them on that. We provide a wide array of health promotion workshops and programs, and we have free flu vaccination and prevention programs each fall. So again, we use this access fee to create a comprehensive program that allows equal access to all of our students and gives them a convenient and easy way to take care of their health. I want to thank you for checking out our online presentations today and for trying to learn more information about campus health. If you want more information or would like to contact us, please check out our website at campushealth.tulane.edu. Contact information for myself and our staff are there, as well as a variety of other health resources available for students. Again, thanks and have a great day.